Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today's topic is the basics of disc bulges and disc herniations. Here's a picture of a normal intervertebral disc. There is one located between each level of the vertebral spine, vertebral bodies. The normal disc is 80% water, and the other 20% consists of proteins and collagen. This is looking down on an intervertebral disc, and you can see that there are two areas. One is this outer layer called the annulus fibrosus. It has nerve endings, so it does feel pain, and it's much stiffer than this inner gelatinous area, which is called the nucleus pulposus. I liken it to a jelly donut that has a harder outer covering than the gelatinous, the jelly on the inside. The disc acts as a tremendous shock absorber as you walk, jump, twist, bend, flex. Water comes out of the disc as it absorbs shock, and then the water comes back in order to maintain its height. So between the ages of 20s to 50s, disc degeneration occurs due to a number of factors, and these can be obesity is one, smoking, repetitive trauma, such as having a job as a truck driver where you're constantly bobbing up and down. There are also genetic and environmental factors that haven't fully been fleshed out. And this can lead to loss of fluid in your discs, so you don't have the 80% water. It can also lead to loss of height in the disc as the water leaves, and then tiny tears or cracks in the outer area, which is, the annulus. So here's a cartoon that shows a normal healthy disc up here, and then two levels that have been compressed, and then goes back to healthy. So a disc bulge is when you lose water in the disc. It's almost like a tire losing air. The result is that you start to lose height, and then it starts to bulge, kind of like a flat tire, or a tire as it's getting flat starts to bulge out. And here you can see that this is an MRI looking at the spine from the side. These are normal intervertebral discs. They're predominantly white on the MRI, which means they have a lot of water, and then it gets dark. And what's happening is this disc is losing water and degenerating, and it's starting to bulge out. It's starting to bulge out forward and backward towards the spinal canal, which is what this is. Okay, so that's a disc bulge. And then you can see at the bottom here it gets healthy again. So 35% of individuals between the ages of 20 and 40 have evidence of degenerative disc disease on an MRI and no back pain at all. So this study showed that just because you have disc bulging and degeneration doesn't mean that you're definitely going to have pain associated with that. So there's not necessarily a correlation. Now, a disc herniation, on the other hand, is when you actually get a tear in the annulus and the inner part of the disc squeezes back. So here you have a normal intervertebral disc. Here you have a disc bulge. Okay. Now it's gone all the way to there's a tear here, and the disc has come out a lot, and it's pinching on a nerve root here. So there are various names for this. It could be called a herniated disc, disc herniation, slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. They all refer to the same thing. Okay. Now, what are the symptoms of a disc bulge or a herniation? As we discussed, there may be no symptoms at all. Now, bulge symptoms may include back pain if there's a tear in the outer area called the annulus. We know there are nerve endings there. It also may spark up some inflammation, and that inflammation may envelop an adjacent nerve root. So you may actually have sciatica pain, but not even have a disc herniation. And then it can also lead to some muscle spasms and aching. If you have an actual disc herniation, that may not cause any pain at all. Or if it hits a nerve root, it may cause burning and searing pain, known as sciatica, pins and needles, some numbness sensation. Motor weakness could be present, which is, for instance, if you have trouble lifting up your foot. And then rarely you might get incontinence, and that's a surgical emergency. Well, what are the treatments for a disc bulge or herniation? If there's no symptoms, there's no treatment, right? I mean, it's not an emergency. Benign neglect is when you know the situation exists, but it's not bad enough to warrant treatment. Once you get into the mild and moderate pain, over-the-counter medications such as Tylenol, Advil, those can be indicated and be very helpful. Physical therapy can also help strengthen up the muscles around the back and lead to less pain. Spinal decompression therapy and chiropractic treatment can help. And some of that overlaps with physical therapy, like if you do the ultrasound, the electrical stimulation, a lot of the exercises. Spinal decompression therapy is intermittent spinal traction that can help pull apart the areas of the intervertebral disc and allow oxygen and blood flow to come in for repair. Prescription medications that may be offered include a Medrol dose pack, which is a large dose of prednisone that tapers off. You really only want to give this once every few years because there can be some side effects. Narcotics for when times are bad, as well as non-narcotic pain relievers such as tramadol. Muscle relaxers when there's significant aching and spasms. The neuropathic medications when there's sciatica nerve symptoms present, such as Neurontin or Lyrica, can help. And there's also a lot of topical types of medications, such as capsaicin, lidocaine patches, or anti-inflammatory creams. Interventional treatments that are available for disc bulges and herniations that are symptomatic include trigger point injections, which can be very helpful for the aching and spasms. Intradiscal injections of steroid medication are effective, but they're not extremely popular. There have been some studies showing they can provide a few months of pain relief, but they're not done too often. Epidural injections can be great for nerve root symptoms. Here's one shown here. What you have is the needle coming in, injecting steroid around this area of the pinched nerve. Does it fix the problem? No, it doesn't, but it can provide a proverbial band-aid and excellent relief while the body can disintegrate this piece of disc that has herniated out from where it's supposed to be. Well, what are the outcomes? Over 75% of individuals with degenerative discs and disc bulges are able to avoid the need for surgery, which is great because surgery for significant disc degeneration and bulges is not always a home run. Out of those with sciatica symptoms due to either a pinched nerve or irritation from annular tears, over 95% of individuals are able to avoid the need for surgery. The outcomes of disc herniations at 1 year are no different than when you have surgery versus when you don't. That's what's shown in a Journal of American Medical Association study. The top pain management clinics in Nevada are part of the Nevada Pain Network. They have comprehensive board-certified treatments with medical and interventional pain management, chiropractic treatment, physical therapy, spinal decompression, acupuncture. There are several locations offered, taking over 50 insurance plans. They've won the Patient's Choice Award 5 years in a row for their high level of skill and excellent bedside manner. The number to call is 702-323-0553. And also you can visit us on the web at nevadapainnetwork.com. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.